Qualified, professional, and compassionate doctors talking real solutions to real health problems.
The month of September, we celebrate the efforts taken against sickle cell disease. Yes, the month of September is Sickle Cell Anemia Month. And with me in studio, I'm pleased to host two great individuals who are leading the fight against this dreadful disease, sickle cell anemia. On the far end is, we're pleased to host Dr. Kasiri Philip, a senior pediatrician and hematologist with Mulago National Referral Hospital, and the head of the sickle cell clinic at the hospital. Welcome to the show,
Thank you.
Dr. Philip.
Thank you,
Yes,
Dr.
glad
Aaron.
to have you back.
Thank you, Doctor.
Yes.
And hello, viewers.
Yes, I'm sure the viewers will be very excited to hear from you again from last time when we talked about the sickle cell anemia. And now on my immediate left is a lady who is the executive director of the Uganda Sickle Cell Rescue Foundation. She's going to tell us a lot more about what the foundation is doing to help people living with sickle cell. Most welcome to the show.
Thank you.
Ms. Nagawa
Thank
Tracy.
you, Aaron. Thank you. It's
Yes,
a pleasure to be here.
Pleasure to meet you.
Yes.
And I am your host for today, Dr. Dara Sowachi. So, without wasting much time, let's understand more about sickle cell disease, but specifically what Ms. Tracy's organization does. So, Tracy, could you tell us more about the Rescue Foundation of sickle cell, sickle cell anemia? What is it about?
This organization, Uganda Sickle Cell Rescue Foundation, was formed in 2013 by one Dr. Blai Mwanga aka BMK, and one Major Lukia Mlomba. She's in the U.S. Army in the United States. She's called Major Lukia Mlomba. So later on, we are joined by Roofings, Lalani, Skanda, if you know him, and AGT Group is an agricultural company. So those are the four directors of this company, of this organization. Sorry, the ones that came together and realized that there is a danger in Uganda that needs to be tackled. Two of them have sickle cell children. Major Lukia Mulumba had a sickle cell child. But she had a bone marrow transplant. Now she's okay. So is Dr. Skanda Lalani as well. He has sickle cell children, but they're all undergoing bone marrow transplants. So that's the spirit. But BMK has he has no child, but he's just passionate. He's giving back to society. He's just
so the inspiration comes against the background of people who have either their children have had sickle cell or they know someone who has had sickle cell.
Yes. But
so what is the goal of the foundation generally? Because when you hear it, it sounds a rescue foundation. It's like rescuing from danger, what exactly does it do?
The rescue part is we are trying to help the public understand sickle cell or get to know sickle cell before they go into marriage. So you kind of rescue them from going into the situation. So our major objective, our major goal is to test and screen for sickle cell, and we do it free of charge. So that the public gets to know their statuses or their genotype. It's called a genotype before they go into
marriage. The details about sickle cell.
Yeah, of course.
So maybe Dr. Phil, to engage a bit. The foundation is supporting people living with sickle cell or families whose children have sickle cell.
Let's say families, because it's a whole entity. You don't have to go with only the child, you go with the whole family, because it's a whole different level of understanding sickle cell and living with it as a family and as a sickle cell patient as well. So we go with the family. Yeah, we do really help the family.
Okay, so just to give the viewers a bit of context, because people may not know what we're talking about. We're saying foundation, sickle cell, they're like, what is sickle cell? Yeah? So Dr. Philip, what is this sickle cell we are talking about, whose Tracy's organization is helping to support?
Okay.
Yes.
Maybe just a little bit, in addition to what Madam Tracy has mentioned, the burden of the problem of sickle cell concerns all of us. And that's why the Ministry of Health opened doors to work with those other non-government organizations and everyone out there to increase awareness and therefore contribute towards the efforts to fight, to work to prevent or reduce the burden of sickle cell in Uganda.
Okay.
And that's where this organization come in. Okay.
So it's a collaboration between
Yes.
NGOs and then the government
Yes.
for a common goal of preventing sickle cell.
Perfect.
Okay.
So going to the subject of sickle cell is actually a genetic disease. Meaning-
Spoken some big words there. Yes.
Meaning
so what do
that,
you mean by genetic disease?
It's a disease people are born with as an part of them, an integral part of them. You know, those small building blocks called genes are what actually determine who we are.
And where do the genes come from now?
And we get those small building blocks from our parents.
Okay.
Okay? So we get part of the building blocks from the mother and the other from the father. So sickle cell happens to be one of those diseases that are passed on in that mode, using that mode.
It is not like malaria where you know the
No,
mosquitoes
no,
will come or the
absolutely no.
typhoids. You know?
Yeah.
For it, it's a genetic thing. So I mean it comes in families, it moves in families.
Perfect.
Okay.
And therefore, people with sickle cell disease are actually born with it. And specifically, they are born with an abnormality in their red blood cells. Ordinarily, what makes the blood appear red is a pigment called hemoglobin.
Okay,
So
deep inside the blood.
Exactly.
That red color of the blood.
Yes.
Okay.
So it's made by a pigment called hemoglobin, which is contained in round cells called red blood cells. And it helps to transport oxygen, which is facilitates us to live, the breath of life, from the lungs to the different parts of the body for the body to function normally. So people with sickle cell disease have a change that occurred or was passed on by the genes from the different parents to this child. And they create a scenario whereby this child has some changes which are abnormal in the way those red blood cells function.
Interesting.
Yes.
So I think in summary you're saying some components which are in the form of genes come from one half from the mother, one half from the father, they combine and make the child, but that child will have the genetic makeup, which is I think combination of the parents' genes.
Yeah, true.
Yes.
Yes,
Yeah, true.
is what will equal the sickle cell. So if the parents have, I think they call them traits, is that the word is still there?
Yes, it's
Traits,
still there.
Like having half normal genes and half
For sickle cell?
genes. Let's say sick genes in a way.
Okay.
So if so how a child with sickle cell comes about is if the child gets can you say sick gene, is that
The
correct?
sick
Medically
gene or
correct?
the part that has sickle cell from the father
Okay.
and another that has
So
sickle
the
cell
child
from
gets
the mother.
both genes.
Yes, please.
The sick one from the father, sick
And-
one from the mother.
yeah.
They combine two, then that's
Exactly.
sickle cell.
Perfect.
All right. So it seems to be something that children can't do. You know, they're just born like that. So
course.
how is the foundation supporting such children? Let
So
alone all the challenges of which the children face, which I want to discuss much later in the show. But maybe specifically, why do we celebrate September? What is the role of the foundation in supporting sickle cell?
there are two questions involved. Why
Yes.
September?
Yes, why September?
September is not, there's nothing specific about September. It's just like you want to.
Is it the S because it's S?
No, really, I don't think that's what the ministry meant. But we just want to remind people every time, you know what, there is sickle cell. Please wake up. It's like a wake-up call. If it was supposed to be the whole year to always talk about sickle cell, we would have it. We will do it. But you know, we're having specific months. We had the Kabaka Run, remember?
Yes,
that is in April. For 3 months.
This year it didn't take
No, it
place.
was he gave us. You know, Kabaka's birthday. They give you a chance for 3 years. So we ran for 3 years.
Okay.
Yeah. Then there is the World Sickle Cell Day, where the world is celebrating sickle cell warriors. We call them warriors. We don't want to call them sicklers because it's stigmatizing. You know, you don't want to, like you have whooping cough, or someone tells you whooping cough, kafuba. It's stigmatizing. But when we give them a name that like gives them power and they feel like, yes, I have sickle cell, but yes, I'm a warrior. I'm fighting. There's something I'm fighting. It's not going anywhere. It's staying with me. So I'm fighting with it. So I'm a warrior. You know, that's the word. That's why we call them warriors. And then there is the Sickle Cell Awareness Month. This is the Sickle Cell Awareness.
We've been doing
September.
Yes, it's the awareness month.
It doesn't mean we are resting all the other months. No, but we enforce. The armies, the noise is too much. That's why I'm here on the doc show. That's why Dr. Kasiri is here. That's why everybody else in the sickle cell advocacy is out there making noise like, hello, sickle cell is still there. Yes, despite the COVID, yes, we have COVID, yes. You know, this is the noise now running. Actually, this is the perfect time. People every focus is on COVID. But then you are making them realize, hello, sickle cell is not going anywhere.
I totally agree with you. Yes, the COVID has temporarily taken attention away from everything. Yes, but there are still so many diseases
that are actually still existing. And
cancer, pressure, you name it, even malaria, a number of diseases. So we are glad that your organization and Dr. Kasiri and the whole medical fraternity is coming up to raise the awareness about sickle cell disease. If you don't know what sickle cell disease is, please stay tuned. We are discussing it in depth in this show. What exactly causes it? Is it that if someone has sickle cell, can they pass it on to maybe their friend by sharing cups? Oh, they know those common questions. People have very interesting ideas and understandings about sickle cell. So don't go. We'll be right back after the break. If you have any question regarding sickle cell, please forward it to our social media platforms. We'll be happy to respond to you. In the meantime, please stay tuned. We'll be right back.
You are watching the Doc Talk Show.